Hello, welcome. So, my name is Anita. I'm one of the trainers for Tank GH and I train for midwives. So, thank you for joining my class and I hope you don't regret it. And all I'm wishing you is the best in your examination. So, at the start of the class, before everything, I want to talk to you about how the whole class is going to be like. So I'm going to give you a bit of an introduction into the midwifery Osce, what you are to expect, what are you going to be doing. Before we go into syllables by syllables, that is station by station, please, is that okay? I know that there are so many information out there, but bear in mind everything I am giving you is from past experience, what the common things that people feel from, and the required information that NMC is asking for us. So you booking me means that you have booked a midwife who is currently practicing in the UK. So I've got that current UK midwifery knowledge to share with you. Also, I am certified as I have gone for the training for the midwifery Osce trainers. So this is a plus. So, and I'm also a master's student doing education. So thank you so much for giving me the opportunity to share my knowledge under the midwifery Osce to you. So we are going to be talking about the introduction, that is the overview of the midwifery Osce. Is that okay? Now, this is how our class is going to be. So you booking me, I have all this information from you. You get to watch, you get to learn, you get to make your own notes, jot down questions, then you book a session with me. So in a week, you get to book twice or once based on your own flexibility. So this, you can visit the class at any time. You have like a whole week to do the learning. Then you book a session with me. We do practice test. So you having a virtual session with me is going to be a practice test. But this information I'm going to be sharing with you is all learning purposes for you to have an understanding of what you are going to do. I hope this makes sense. So the midwifery Osce, initially we used to do 6 stations, which was the legacy, but now as of 2021 we have been doing 10 stations and they keep updating over and over again to make it more versatile for us. Is that okay? Now, if you are going to be sitting your examination, you are going to be doing 10 stations. When someone will say, what is 10 stations? You just think of it like 10 practicals. Is that okay? You are doing 10 practicals. So if you are doing 10 practicals, the first one is called assessment. The second one is planning. The third is implementation. And the fourth is evaluation. These 4, they come together and form an acronym called API, A-P-I-E. So you get to hear people saying API, API, API. What is API? Yes, it is 4 stations combined given to you. But you don't get to push, they don't push all the 4 stations to you. First do assessment, which is a set of minutes. They keep changing the minutes, so I wouldn't want to say this now. During our practice test, I will time you per the actual exam minutes. Is that okay? I will also attach some timings of the midwifery Osce for your learning. So you do the assessment. Once you are done with the assessment, then you do the planning. After that, you do the implementation, then you do the evaluation. You will be doing all the 10 stations at a sitting. You will get time for a toilet break. You need to take a water, you need to do any form of emergency. Speak with the examiner. Now we've talked about 4 stations. Then we come to what we call skill stations. There are 7 in number currently. So we have the postnatal check, we have the newborn examination, postnatal care, we have the birth scale, we have the IV flash, we have the intramuscular or subcutaneous injection, then we have the catheter removal. Now, it's either the examiner is going to let you do 3 skills or 2 skills. If you are doing 3 skills, just know that these 3 skills are going to add up to your EPI, which is 4 stations, to make it 7. So now, if you are doing 3 skills in addition to EPI, you have already done 7 stations. If the examiner gives you 2 skills in addition to your EPI, then that means that you have done 6 stations. Now, the next thing we have is obstetric emergency. Okay, obstetric emergency, we have the PPH, we have the breech birth, and we have the shoulder dystocia. Now, these 3 add up. So for a person who has gotten 3 skills doing, the examiner gives you 1 emergency in addition to become 8 stations. If you did 2 skills in addition to your EPI, making it 6, then your emergency, they are going to give you 2 skills in addition to form your 8 stations. So if you have to think about it, put it this way: emergency stations plus the skill stations, they come together, then the examiner picks 4 out of it for you. Whether you are getting 3 skills is to 1 emergency, or 2 skills is to 1 emergency, or 1 skill is to 3 emergency. That is dependent on the examiners. Is that okay? So you have 4 in addition to your EPI, which is already 4. Now you have done 8 stations. Then the last 2 is what we call professional value station, which is station 9, and evidence-based practice, which is station 10. Is that okay? So if you've done the 8, you're either going to do professional values, you're going to do professional values as your station 9 and evidence-based practice as your station 10. I hope we have understood these basics. So if you are learning EPI, and we the midwives, you know that as midwives, we take care of pregnant women, women in labor, and postnatal women. So in terms of EPI, it has been divided into 3 categories. So let's say I am the candidate, I can go and I'll be given a pregnant woman to take care of. I'm going to do her assessment, I'm going to do her planning, implementation, and evaluation. It is called antenatal EPI. If I am giving a woman in labor, I'm going to assess the woman in labor, plan her care, implement her care, and evaluate her care, and that is called labor EPI. Or I could be giving a postnatal woman where I'm going to assess her, that is do her postnatal assessment, plan her care, implement and evaluate, and that is called the postnatal EPI. You will never or will not go and do antenatal EPI and do labor EPI and do postnatal EPI. No, you are doing antenatal EPI, or you are going to get labor EPI, or you are going to get postnatal EPI. So whichever, but just know that if you are getting a labor EPI, you are just going to take care of a woman in labor. If it's postnatal, you're going to take care of postnatal woman. And if it's antenatal, you are going to be taking care of antenatal woman. Is that okay? So this is just a general knowledge of how the Osce is going to be. Now, at the sitting, you get to register, they do your ID checks, you sit in the lobby, the examiner comes to call you in. The examiners and all the support team, they arrange the examination hall for you to come in. You do not know your way around. Once you get in, they will orientate you before you start. So it's not like you are going to be doing, where is my needles? Where am I? No, nothing like that. They are going to orientate you. You'll be served with water. If They will do their part to make sure that you are not nervous. The rest boils down to you. Are you anxious? Okay, you're anxious, that's fine. But don't let that control you. You have learned enough, you have done your best, just move on. It's not okay. So, as I mentioned, those are the 10 stations, and I hope you have understood. What we are going to be talking about next is we are now going to divide them into pieces. So, we are going to talk about the antenatal, we're going to talk about the postnatal, we're going to talk about the labor, then we move on to the skill stations, then we come to the emergencies, and we do the professional value station and the evidence base. Now, after every teaching, I will do a role play of how you can do it in the examination in order for you to pass. So those ones, I'm going to be following the marking criteria for you. So once you are done learning, you get to watch the video to have a fair idea of how the examination is going to be in the examination hall. I hope you have understood. Thank you so much for joining this class and the introduction to Midwifery Osce. If you have any questions, please do never hesitate to send me a message or do call me, and I will respond to you as soon as possible. Thank you, and thank you so much.